Hello, and welcome to your examination. My name is Calliope, and we are going to be doing a little bit of everything today. We're going to start with the heart and lungs. We're going to look at the face, the abdomen, the extremities. So I'd love to get started with some palpation, if you don't mind. Okay, so palpation here, when we are assessing the chest, what we are going to do is we are going to look for heaves and thrills. So a heave, if we put the hand on the chest and use the heel of the hand here, we will feel an actual lifting, an actual heave in the chest. For thrills, we're going to use the flats of the fingers, and we would feel this vibration, this palpable heart murmur. So I'm going to use this part of my hand, across your chest here. So let's go ahead and start right here, the side of the sternum. Just feel for a few cycles. Roll right into some percussion. Okay, down here. Good. And now thrills. We're just taking a few seconds here. And just going over each valve of the heart. There we go. So now we're going to switch from the heart to the lungs, and we are going to do some percussion. So percussion can tell us a lot of different things. It can tell us if there is an area of dense tissue. It can tell us if something is filled with air, liquid. It can tell us if we are hitting on a bone. So, for example, if I just tap into my cheek here without any air or anything, it's a pretty flat sound, right? But if I put air into my cheek, it sounds a lot different, doesn't it? So that's what we're kind of listening for, is those differences in the sound. So I'm going to start here at the lung apices, and then we're just going to move our way down in a bit of a ladder-like fashion. So, starting up here. Good. What we want to hear is a resonant tone. And as we get lower, the sound will also get lower because we're more in the area of like the liver and the stomach as opposed to the lungs being up here. So let's pull out the stethoscope. And we're going to start with the heart. So we're going to be listening to some valves. And what I want to do here, so your heart is on, this is my left. We are going to come right at the sternum here. And at the second intercostal space is going to be our aortic valve area. So we listen to that. We go right to the other side for the, just listening to my heart. This is where our pulmonic valve is. And we have Erb's point, but we're going to skip down a bit. And then we have the tricuspid valve. Mine sounds pretty good. And then we go from the midclavicular line quite a bit down here. This is the fifth intercostal space. And we listen to the mitral valve. So, on you here, we're going to go to the right of the sternum, the second intercostal space here, and listen for a few cycles of the valve opening and closing. And then move laterally the other side of the sternal body. Okay. And fourth intercostal space right along the sternum there. Good. And then midclavicular line, fifth intercostal space. Just quite a bit down because this is where your ribs curve as opposed to going straight across. Good. And Erb's point here is between our pulmonary and tricuspid valves here. So now we're going to listen to the lungs. This is where I'm going to have you take some deep breaths. And like the percussion, we are going to start at the lung apices. I'm going to have you take a deep breath in and out. And then we switch to the other side here. And then we come down to our second intercostal space. Do it again. Down. And come to the other side. That way we're always comparing one side to the other. So, I'm going to have you take a deep breath in and out. Deep breath in and out. Okay, move down and just a little bit out. Deep breath in and out. Deep breath in and out. Okay. And then we go past the fourth intercostal space here, more the midclavicular line. At least getting a little closer to that. Deep breath in and out. Deep breath in and out. Good. And down and out some more. Deep breath in and out. Deep breath in and out. Last row is the bottom of the rib cage here. Deep breath in. Out. Deep breath in. And out. Good. Okay. So now we're going to move to the abdomen while I still have the stethoscope in here. So when we're listening to the abdomen, we're listening to the sounds that the intestines make, your digestive sounds. We can also listen to, for example, the renal arteries. So we can divide the abdomen into quadrants. And I can take a couple listens for a couple seconds in each quadrant. And just work my way around. It's clockwise for me. And just see what's going on in there. Good. Okay, excellent. So we're going to put this bad boy away, and we're going to move back to percussion. So with percussion on the abdomen here, we are listening for areas of fluid, areas of air, dense areas that tell us where the border of organs are. So I'm going to start right here, and I'm just going to tap away here. Okay. Good. Want to hear if there's an area that should have fluid, like the bladder, for example. Areas that should not have fluid, areas that have air, areas that should not. Make sure the organs are of normal size, especially right here. This big guy, the liver. Good. Okay, now here comes the palpation. So I'm going to be feeling around in the abdomen here. So I'm going to have you just try to breathe through it. I'm not going to try to punch the air out of you, but we want to see if there are areas tenderness, if there's any hard, rigid areas. We want to feel certain organs like the spleen, the kidneys, and the liver. Are you experiencing any pain or tenderness here? Okay, good. All right, so let's go ahead and move to the face. And I want to start by looking at some muscles. So, right here, we have a big muscle called the masseter. And we also have a joint called the temporomandibular joint. If you clench your teeth and release them and clench, you can feel the masseter engage. You might see that jump a bit. And if we move the jaw up and down, we can feel that joint move around. And then we also have a muscle here called the temporalis, right in here. And again, if you clench, you can feel that muscle tick right here at the temple. And we just need to assess that one as well. These are all important areas for chewing and for moving the jaw. So let's start right here, the temporalis. I'm going to have you clench your jaw, unclench, clench, and unclench. Good. And the joint here. I'm going to have you open the jaw, close, open, close. Can you move it to the side? The other side? Okay. And then the masseter here. If I could have you clench the jaw, unclench, clench, unclench. Good. Okay. So, did any of that feel painful at all? Okay. Did you feel any restriction in movement? Okay. I didn't feel any clicking or anything of note with the joint, and the muscles felt just fine. So let's take a look at your sinuses next. Now we talked about percussion, but that's actually a method of indirect percussion. So instead of directly tapping on the skin, instead I have a buffer. I have my hand, and then I don't do it very well with my non-dominant hand, but I tap on this hand. That's a buffer. For the sinuses, we can use direct percussion, where we actually tap on all these areas. So we have the frontal sinuses, the ethmoid, and the maxillary. And I'm just going to be tapping on these to see if there's any pain or tenderness. Okay. Alright, so I'm just going to tap on the frontal sinus. Okay. And the ethmoid. The other side. Okay, and the maxillary. The other side. Any pain or tenderness there? No? Okay. So So I'm going to continue by just looking very generally at the skin. So we'll look for scars, moles, lesions, areas of sun damage, erythema, anything like that. So I'm going to just have a little look here at the forehead and doing a little bit of palpation here and the cheeks. Right in here. Not forgetting the temple here. Good. The jaw. And the chin. As well as the nose and maxillary region, all the way up to the cheekbones. Okay, excellent. So, lastly here, I want to assess the temporal pulse. So if you put your fingers right here, you will feel a pulse right there. So I'm going to assess your temporal pulse one side at a time. Good. That's pretty strong. Quite bouncy. And then this side. Very good. Okay. If we get a little fancy here, let's see if we can get this to work. So, I'm going to locate the pulse. There it is, and we can put the stethoscope there. Yep, and there it is. We can listen to the pulse there, so if we have that right there, just put the stethoscope on there. This is more just for funsies. And the other side here. Great. Now, right, so let's take a little look at your eyes. So what I'm going to do here is I have a light here, and I'm just going to be bringing this light in at an angle, and I'm going to be watching how your pupil reacts to light, which you probably can't see mine, but this is just how that process looks like. So I'm gonna have you just real quick look back here. Good, and that just helps to dilate the eyes. Okay, look at my nose. Good, and we're just going to bring this in at an angle. Good. Okay. And good. Excellent. Just keep looking straight ahead. Mm-hmm. There, good. And excellent. So now I'd like to look at your So typically what we do is something called the H test, which allows us to check that your eyes can move in all different directions. So I'm going to have you just look at my fingers here and just follow them up, down, good, up, down, up, down, good. We're looking for nystagmus, which is an involuntary shaking of the eyes. Looking for lid lag when we go up and down and down. And just making sure that your eyes can move in every direction. Now we're going to test the accommodation reflex. This allows you to focus right up close as well as way far away. And I'm going to be bringing my fingers in, which might make you a little cross-eyed, and then out, in, and out. Okay. Alright, so let's look at my fingers here. Bringing them in, out, in, and out, in, and out. Good. Right here. In, and out. In, and out. Now let's take a look at your ears. So, if we look at my ear here, we've got a few different parts. We have the lobe, where I've got my little rings here. And then we have this cartilaginous part called the helix. Little ring here. We have the triangular fossa, this little dip in the ear. We have the antihelix. We have the tragus, this little fleshy guy. We have the antitragus right here. We have the concha, which is sometimes called the bowl of the ear, this little area in here. We have the external auditory meatus, right here at the beginning of the ear canal. And behind the ear, we have the root of the ear where it attaches to the head. So I'm going to be just palpating all these little bits. I'd like you to tell me if any of this is painful or tender at all. Okay? So, just going to be feeling around here. Okay. I'm just kind of inching and poking here. Any pain or tenderness at all? Okay. How about on this side? spots that shouldn't be there because you can't exactly see the back of your ear on your own. You have to have someone else do that. So now we will look inside the ears with the otoscope. So what I do here, flip on the light, and I'm not going to put this in my ear, I'm just going to show you. We would put this in the ear canal here, and I would use my hand to keep me propped up so I don't accidentally bump into you or poke you at all. But we would just move around and look at all of our little structures inside. So I'm going to be pulling up and back, which straightens out the ear canal. Back. Good. And then we are going to look around here. So the ear canal is only a few centimeters long and about half a centimeter wide. It's very small. And at the end, we have the tympanic membrane. But before that, we have a clear area, and then an area with little hairs and the glands. Then we have the opening. Good. Okay, so we want to check for any blockages in the ear, and we want to check the health of the tympanic membrane, making sure that of the right color. There isn't any perforation or bulging. And we have our little landmarks there. Okay. So now let's take a little look at the nose, the mouth, and the throat. So I want to just have a little peek at the nose. I'm going to grab my flashlight. And we're just going to check inside each nasal passage. Look at the septum. Okay. Excellent. Do you have any issues at all with breathing on either side of the nose? Okay, so what I'm going to do is I'm going to occlude one side of your nose. I'm going to have you breathe in and out, and then switch to the other side. Breathe in and out, just to make sure that you can breathe through both nasal passages. Have you take a deep breath in and out. Deep breath in and out. Or rather, good. Deep breath in and out. Deep breath in and out. Good. Okay. Let's look at your mouth and throat. So we've looked at the lips and the corners. We will be looking at the tongue, looking underneath the tongue, the insides of the cheeks, the teeth, as well as the throat wall. Have you just open your mouth? Okay. Just want to look at the gums and the salivary glands. Could you lift your tongue to the roof of your mouth? Okay, there's no central cyanosis there or anything going on with the floor of the mouth, so you can put your tongue back. Okay. So, looking at the teeth. If I could have you stick out your tongue, that way we can get it out of the way. And then I can just put that one there. And then we can look at the uvula. If you could say ah for me. Good. And the throat wall. Smooth, pink. Do you have your tonsils? Okay. Alright. Everything looks great there. Now we have the neck. And a little bit of the surrounding area because we're going to palpate for the lymph nodes. So I'm going to start behind your head. There we go. These are the occipital nodes. Behind the ear. Behind the ears here. The post-auricular nodes. Pre-auricular nodes. Parotid gland. Jugulo-digastric, submandibular, submental, and then we get into the neck here. So our guide is going to be the sternocleidomastoid muscle here, this big guy. And we'll have lymph nodes in front, behind, and underneath. So, superficial cervical, posterior cervical, and the deep cervical chain. And then in the supraclavicular fossa here, which is above the clavicle, we have the supraclavicular lymph nodes. Okay, good. So we are going to be first auscultating the carotid artery, and we do that to make sure it's safe to palpate. So I'm going to grab the stethoscope, and right where I had my fingers there, we're going to listen. I'm going to have you take a deep breath in and hold. And then let it out. Because that air traveling through your windpipe can get very loud. So we're going to do this side first. So I'm gonna have you breathe in and hold and out. Good. The reason we're doing this, breathe in and hold, is we're listening for bruits or audible heart murmurs. Exhale. And then we can determine that it's safe to palpate the pulse there. I'm going to do this one side at a time. And like our temporal pulse, pretty strong, bounding. The other side. Yep, that's great. So lastly, I'm just going to assess the trachea here. So mine here is midline, and I can feel it, and we can also feel the thyroid, assess the thyroid here, the isthmus, and the lobes of it. So I'm just going to make sure this is midline. Okay, and for the thyroid, I'm just going to have you take a dry swallow. Okay, just like that. There we go. Okay. Alright, that feels just fine. Last thing we're going to do is just take a look at your hands, your arms, legs, and feet. So, on my hand here, we have a fairly healthy specimen. The skin around the nails is dry, but there are no deposits or nodes. There is no split hemorrhaging in the nails. The nails are clear and uniform. We can check the capillary refill, so we can press down and let the skin blanch and then release. And if the circulation returns in less than 2 seconds, then that is normal. So the surface of the palm is clear, as is the hand. There's no contracture here, no wasting of the thenar, hypothenar muscles, no palmar thickening, nothing of any note. So if I could just look at your hands real quick. Just gonna look at them. Yep, palm side down. Good. And then you'll flip them. Yep, so I can look at the palms. Good. Okay. And then your arms. We can assess the temperature and make sure the joints aren't warm. Looking for clamminess, that sort of thing. We feel with the back of the hands, and we look for signs of psoriasis, of plaque psoriasis here. The only thing I have of note is going to be keratosis pilaris, which is annoying and gross looking, but ultimately harmless. So we look at each surface here, make sure there's nothing awry on the skin. I'm going to feel the temperature. And then if you could show me your elbows. Okay. And we basically do the same thing on the leg. So the shin is going to be just like our elbows. That's where we're going to see any skin issues. And we look at the feet, the toes, the nails, the sole of the foot. And that all looks great. So that is going to wrap up our examination today. Did you have any questions at all? Okay, let me just sign off here. There we are. So I'd like to thank you so much for joining me for this examination.